All right, so I asked you last week, what does it actually mean to have prostate tenderness? So let's say you've been to the urologist, they've done an internal digital rectal examination, they've pressed on your prostate and it hurts. Let's begin there. What does this actually mean? Well, not a lot, actually. So prostate tenderness can appear in asymptomatic men. And the studies suggest that maybe it's as little as 5% of asymptomatic men have prostate tenderness. Other studies suggest that up to 50% of men who have no pelvic pain symptoms may even have prostate tenderness. Even if you've got a diagnosis of prostatitis, it doesn't mean that your prostate is going to be tender. About 40% of men with confirmed chronic pelvic pain syndrome or chronic prostatitis had prostate tenderness on exam. And that means that tenderness alone can't diagnose what's happening in and around your pelvis. And the absence of tenderness doesn't rule out the symptoms of CPPS or prostatitis. So tenderness in the prostate doesn't actually tell us very much about inflammation either. So we're looking at prostate tenderness has no correlation with white blood cell counts or bacterial cultures in prostatic secretions. You can have a very tender prostate with zero inflammatory markers and a normal feeling prostate with significant inflammation. So, and it's really, really ambiguous, isn't it? The prostate is rarely the only tender structure. So often a patient might experience tenderness in and around the pelvic floor. The prostate may actually be all right, but it's often the prostate that is pointed to as the culprit because the term prostatitis suggests that all of this stuff is happening within your prostate. It's so deductive. We need to look broader than that. We need to look at other factors.